Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
So I've been having back pains for many years, probably for too much playing tennis and soccer. I do have arthritis. I know that in all of my joints, surgeries in different places, but it's progressively getting worse every year. In winter time, it gets really painful and locks up quite often. If I stand up too much or I sit down too much, it locks up. And I have to do a lot of stretching, a lot of inversions and
So you do inversion
decompression to relieve that pain. Because sometimes I can't even walk straight. I can't keep my back. It just
so you're walking like forward.
Back.
So how many years have you been experiencing back pain?
I would say at least 20 years.
20 years. So for the 20 years, what kind of treatment, who doctor you saw, and what the recommendation?
I've seen plenty of doctors. Usually they give me anti-inflammatory to relieve the inflammation, and also sometimes painkillers if it gets too bad. I try to use again inversion table, and I've seen some specialists. They've taken MRIs, X-rays, the whole thing.
What they found?
They found a bulging herniated disc.
What level?
Between L4 and L5. That requires surgery to relieve the pain.
So they recommend surgery. How many surgeons recommend surgery?
3 of them.
Oh, so you went to 3 surgeons and all the 3 recommended surgery.
They all did, and one of them told me, listen, if you can take the pain, I wouldn't do the surgery because there's no 100% relief. You know, it might not be 100% effective.
Nobody guarantee 100% effective.
Exactly.
Yeah. So current symptoms, what kind of symptoms do you experience? Do you have sharp shooting pain to your legs?
Now that the weather is getting warmer, it's not as painful. It's more stiffness in the morning. But in the winter time, when these pains come, I have shooting pain down my left side, sometimes numbness. Sometimes I can't even feel my foot. I can't walk, put any weight on it, or it just gives away. And sometimes I have shooting pains right down my leg, and even tingling sensations. And
you feel it in the whole lower extremity, or you feel it in your feet?
It starts from here, from the side, all the way, especially here in the hip. That 90% of it is probably in the hip, and then it starts shooting down sometimes.
So how much pain from 0 to 10? 10 is emergency or much worse?
When I have the sharp pains, it's probably 8, 8.5.
What about now?
Now it's probably maybe 1.5, 2.
And tell me, and mark on your legs how far you can go. So really, touch your legs. So you
knees locked.
Yeah. How much pain from 0 to 10?
Probably 3.
Okay, backwards.
It's my hamstrings.
My hamstrings are tight. Yeah.
Very tight. Left side. Right there.
How much from 0 to 10?
About 2.5.
2.5.
2.5, 3.
So twist left and right. That side bend.
There's some pain there, about 3.
Okay, and the other side. Do you have sharp shooting pain or just localized in the back now?
Just localized in the back right now.
Okay. In the morning you said, or when it's cold, you start to have the sharp shooting pain.
Yeah.
Twist.
Some, about 1.
Okay.
Not bad at all.
Okay. So there's no pain. So when it goes down to the side. Okay. So you're actually pretty tight. So it's all around this area. How does it feel? It's good. Okay.
Huge difference. Oh my God. I don't feel anything anymore here. And I can go down probably lower.
Let's do the twisting, and we'll have you step forward a little bit.
The pain was 3. It's probably 1 now.
Let's drink. We'll go over that with you. Backward. That's further. That's a lot
much further.
Yeah, that's good. Down. Let's mark on your legs how far you can go down. That's good. You were mid leg.
Probably about 4 or 5 more inches.
Yes. Any pain or it's gone?
There's, I wouldn't say pain, discomfort.
Where?
And
with which motion?
Pretty much same area.
Mm-hmm.
Yeah. I can't even pinpoint it anymore.
Okay, let's drink more water. Sometimes it takes like a few seconds. And your body gets used to the release and the range of motion. Let me know if you feel it, okay?
Yeah, more to the center now.
It's a center.
More to the center now.
Not on the side.
Not on the side anymore. I used to feel it more on the side, but now it's more located to the
How
center.
much from 0 to 10?
No pain.
I'm gonna work a little bit on the inflammation. Do you have seizures? When you felt it in the center?
Mm-hmm. Yeah, it was towards the center.
Okay.
Left side of the center. Yeah.
Okay. Okay.
There's still some pain, but
0 to 10?
mild. Maybe 1.5.
Okay.
No pain.
Okay.
Some discomfort, but no pain.
How's that? You're going further now. Look at
Much
that.
further. Yeah.
Yeah,
And
it's
there's
a lot
no
more.
pain, just discomfort.
Okay, so let's do this, okay? Because we know you have arthritis there. I'm gonna put the magnet in the back, okay?
Sure.
And I will have you do the motion and tell me if your pain gone when you have the magnet. Let's pull this up a little bit. I just want to have the magnet on the spot. Is that on the spot?
Mm-hmm.
Okay. Let's do the motion again and tell me how that feels.
So we're going back.
Yeah. How's that? With the magnet on.
Excellent. No pain, nothing.
Okay. Let's do the
Not
side.
even discomfort.
Yeah, that's inflammation. That's good. You're going further this way, actually.
No pain.
Okay.
Just discomfort.
Yeah. And we'll have you bend forward. How's that?
Very good.
Can you tell the difference when I put the magnet on it?
A little bit, yes. There's an improvement.
Improvement. So that's the arthritic part that we need to work on with the magnet. That's usually I recommend to wear it for several hours a day, depending on how bad is the inflammation. Right, so you had it for 20 years now, we just did ASTR treatment. Can you tell any difference?
Major difference.
What's the
My
difference?
flexibility, my pain level, the tightness.
Uh-huh.
It's not as tight anymore. I'm gonna have more motion,
Mm-hmm.
and it's more like instead of the pain, it's more of a discomfort,
Mm-hmm.
tightness.
Just
but,
the
but I'm
tightness.
much looser. I can feel more flexible.
That's nice. Awesome. Thank you.
Thank you.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.